Okay, so my darling, this question is about people that have been missing their periods. Okay, been having a lot of questions about late period, people missing their period. Okay, and they are worried. They're asking what is the causes of this and what can be done about this. Well, first of all, let me address this. Your period being late, any period that is late, any period that is 1 day, 2 day, 3 day, 4 day, 5 days, 6 days, 7 day is not considered late. Yes, if you've not seen your period for 1 week, it's okay. This might be as a result of stress. You took a post pill or something. Okay, just hold on. Even up to 2 weeks. Okay, when you get started, when you be worried is when this happens oftentimes. Okay, so you have to find out what is going on, and which I'm going to mention. So when your period is late for like 1 week, just chill, or maybe to some days, 14 days or so, it's okay. Then, so let's why your period, because if you take some pills, this can shift them just a few days. You see people, their period is 2 days late and they are scared, 3 days late and they are already chatting a doctor or calling or going to the hospital. Calm down, chill. Okay, it's going to come out. Okay, so if it doesn't come out in this number of days, then you should see a doctor. So let's get to why your period may miss. Number one is pregnancy. And I advise people, anybody that asks me questions about period, pregnancy, again, I'll just direct them to watch this video or watch it on my YouTube. Pregnancy, when you check after 1 week, it's negative. Hold on, check after 2 weeks again. Then when it's negative, then that's when you can start up. So pregnancy is the number one cause why your period might be late. Secondly is postinol 2 or post pill. This thing messes your period. If you've not watched that video where I talked about how postinol 2 can lead to infertility over the years, go and watch it on my YouTube now. Post pill, especially post pill that you know, emergency post pill, that's why it's emergency, but people take it like water. Okay, it can mess your period like crazy. Talk more of people that now take it like 2 times, 3 times, 4 times in a month. How would your period be stable? Okay, so that's 2. If you're taking post pill months, be rest assured that your period might either come earlier or come later. Okay, so the third one is if you've gained so much weight. Oh goodness, if you've gained so much weight, you added a lot of weight, your cycle is going to be missed. Not everybody, but this is certainly happens. Another one is if you lost so much weight, if you've not been eating, this will mess your period. So your period is going to be messed if you've added so much weight. Another one is your nutrition. If you ate something so like you didn't really mind the things you ate, is going to mess up your period. Another one very important is infection. Okay, yes, infection, you've been hearing it, most people think is a myth. It's not a myth. Infection can make you miss your period. Okay, yes, this infection, gonorrhea, can make you miss your period. It can make you bleed in between your periods, your cycle. Chlamydia, same thing. Syphilis, same thing. Pelvic inflammatory diseases, beg your pardon, same thing. Okay, so infection can make you miss your period. Okay, so another one is lifestyle. If you're not eating very well, I said this in my last video, the kind of food you ate, or you're always staying indoors, you're not exercising, you're not going out, you're not engaging in physical activities, your period can be in a mess. Okay, another one is hormonal imbalance. I've told people, well, not me, Dr. Henry has told people that hormonal imbalance is not the same thing as polycystic ovarian syndrome. Okay, the video is also on my YouTube. You can watch everything about polycystic ovarian syndrome in that video. So hormonal imbalance can make you not see your period. Polycystic ovarian syndrome, PCOS, can make your period delay. Okay, meanwhile PCOS brings about hormonal imbalance. Okay, another very thing that makes you miss your period is lactating when you are not pregnant. Most women are lactating when they are not pregnant, or sometimes not too visible, but when you press it, you might not even know. As I'm saying this, you might not know that you're lactating, except when you press it so hard. There's a way the gynecologist or your midwife or a nurse will express it, and milk and fluid comes out. If this is the result, if the thing is high, the prolactin is high, this can make you not see your period, and this can also make you not take in. Okay, so now lactating when you're not pregnant. Sometimes it's hyprolactin. It depends on when the investigation is being done. So if you're seeing breast discharge, don't keep quiet, just see a gynecologist. Okay, this can mess with your period and mess with your ovulation and delay you from taking in. Another one that can make you miss your period is alcohol and smoking. It can, excess of this, most people are different, bodies are different, can make you miss your period. Okay, another one is some medications. I mentioned how Postinor 2 in the last video and on my YouTube, how Postinor 2 will finish you. Okay, some medications like post pill, emergency contraceptive, contraception too. Okay, or if you're in probably you were on some hormonal pills or some implants to help you prevent pregnancy, and you remove them your period might not peak immediately, or you just implanted them. So all of this thing has a way of scattering your period and your hormones. Okay, so these are things that will mess with your period, make it late, make it early. Okay, another one is this: stress and lack of sleep can mess with your period. It can mess with your period. Either makes it, in fact, most of the times it makes you not see them. It makes them late. Okay, so another one is menopause. Most people entered menopause, they don't know that they've become menopausal. Okay, which is a stage in a woman's life where she no longer sees her period and no longer ovulates. Okay, so these are the things that can make you see your period. Some chronic illnesses like chronic kidney failure, diabetes, not all the time, heart failure, a lot of chronic illness that the body gets weak or the body is under stress. Still, the stress part of it can make you miss your period. So now let's get to what you will do if in the case of obesity or you added weight. Just lose the weight. Try to lose the weight, or that month know how you eat, monitor your food, reduce calories, reduce starchy food, go on fruit, fiber, and engage in exercises. It will help you a lot. Your period might come out. Secondly, if you lost weight, try eating up. There are some conditions where people don't want to eat. It's actually a condition, but they don't know it's a condition. It's anorexia nervosa or anorexia bulimia. Where some people don't want to eat, they are scared of adding weight. Most people, they eat once, they will just eat, let it be like they're eating, and then they'll throw it up, or they are just wanting to maintain a weight. So if you're too thin, if you're on the weight, try to eat up, try to eat healthy. Your period might come back. Another one of things you should do is, if you're on some drugs and you find out that this drug is making your period delay, just meet your doctor. They will have them reviewed, and the hormonal drugs I told you about, your doctors will educate you, tell them what you're going through. They know what to do. Okay, so now, and if you're taking post pills, emergency contraceptive for sex, please, you need to stop. You can just take them for emergency, not all the time. They mess your period a lot. Okay, so what you need to do is know how to calculate your ovulation, which I've taught. Know your safe period and when you're ovulating. Okay, this will help you. Okay, but if you don't know, okay, in the aspect of some lifestyle, stress, try to rest a lot. Okay, if you've done all of these things, you're eating well, you didn't gain weight, or you didn't gain weight, you are not pregnant, you are not menopausal, everything is okay with you, and you're still missing your period, what you need to do is to go and see a gynecologist. They have something to do about it. They have a way of forcing the period out, or of course it's going to be hormonal imbalance most of the times, balancing your hormones. Don't just keep quiet. Okay, don't keep quiet. If you want to watch my video where, in fact, don't worry, I'm going to make a fresh one, where when you don't see your period for a very long time, what is going to happen to you. Okay, so just if you're in this channel, click to it, stay tuned. If you like this video, like it. It's going to make me to do more, because I barely have time. So it's going to push me to do more, answer your questions. You can follow me on all my social media handle, follow, subscribe, and I send you lots of love.